There's these real barriers between the care homes and the NHS organisations.
Communications between the health system and the social care system have been very poor for years.
I think information sharing is the most crucial element of all of this.
And what tends to happen is care homes are often the last to know around changes in their patient's medication, in their care plan. So what we're trying to do is open up that whole barrier.
How do I securely communicate with people across the system? It's how do we talk to each other? That's as simple as it is.
It's bringing in the care homes into the sort of data exchange and information exchange that everybody else in the NHS has the benefit of, and that's around NHSmail.
NHSmail is here for the care providers. It's free for them to access.
I think it's a really big deal getting care homes in London to use NHSmail.
We're able then to allow direct communication from even ward staff directly to that care home.
NHSmail is a secure email service and collaboration service that's used across the NHS in Scotland and in England.
Implementing NHSmail into a care home means that each staff member who is on NHSmail will get their own email account, which is their name at nhs.net.
Everyone gets excited because imagine your name plus nhs.net. It makes you feel like you're a valued member of the health team in the community,
which is really empowering them and helping them feel better about being connected to the NHS.
It then means that care providers can go and say to their health partners, you know, we can join now with your GP system, we can join with your hospital system, indeed we can join with your integrated care records.
And so the level of communication, how we work with care homes, it'll change in lots of ways, both from health and social care, both in primary care, in acute, in the way that NHS 111 responds to care homes, and the way that ambulances respond to care homes.
I think since NHSmail's gone live, it's allowed us to transfer information safely, quickly and effectively so that we can ensure that we can meet the residents' needs from day one.
It's about, being able to access information at the right time, by the right people, those people who need to say to provide that level of care a person needs to get.
They can all communicate securely over the same platform, which has never been the case before. And importantly, that also has a benefit for the residents because all of the people who are looking after their care can talk to each other securely.
Belmont House, it is a 60-bedded nursing home. We have a variety of residents here. When they explained to us what this project is all about, I was so interested and the staff were also excited. You can see the eyes of all the nurses because they know that their life will become easy once we have it.
Before we start this project, you need to phone to make sure that they receive your referral, and sometimes you're on the phone waiting and waiting and waiting and holding. But now, click the button, send it to them, and you can see their reply straight away.
Before, it's very difficult to contact the medical practice or even the hospital. But now, since I have NHS email address, I can easily send an email and request the information I need on that particular day.
This is a big thing where everyone is happy and looking to each other. My God, I heard something already from someone.
We have 64 residents with different medical conditions. We are using the NHS email and we are really working so well. It's starting to bring the feeling of integration and not feeling them and us. We are becoming part of all of us together. And you're feeling there's that respect from professionals to professionals, not like before. You don't feel that you're working in isolation. Now you feel like you can have a conversation with a colleague. We were having a joke with one of my nurses and he was able to speak to a colleague on the phone and say to a community and say, look, I need this help and we've got an NHSmail, we're gonna send you the photo, give us a decision. And we were able to get a decision within seconds through that conversation and he was like, all right, it's fun, calm down. But the nurse was really excited. It is working well, so they're aware and they know the system is there and they use it. They actually use it very well.
We've rolled out NHSmail to our nurses, to our managers. We are now looking at giving it to our administrators. It's allowed us to communicate in a much quicker, easier format. And we're starting to find often now we use NHSmail more than our own email. Historically, we've had to use the fax machine to resolve queries and questions, and that's obviously quite outdated and quite time-consuming. The greatest benefit of NHSmail to us has been the work with the pharmacy. We're constantly having new residents come in, prescriptions, photos have to be transferred. All this can be done by NHSmail, and it makes our life and their life easier, and it makes it really quick for us all to respond.
Care organisations who have been using for NHSmail, they have a tremendous amount of what we call as realised benefits.
The feedback's been really, really good from the care homes. They've been really enjoying having the support that we've been able to give to them.
They have reported that they have managed to save a lot of their time and resources, sending faxes or, being on the phone, trying to reach out to a clinician or a doctor.
Our service users will really benefit from this.
How do we, from the care sector, be able to communicate back into the NHS, to build the confidence of the NHS in the care sector's use of digital?
When you're sending confidential patient information, it has to be bound by rules.
The Data Security and Protection Toolkit is something that the care home has to have in place in order for them to share data.
GDPR came into force last year, and that's a legal requirement for all organisations, and care providers are bound by that.
It's important to have people who are using our service to have the confidence that their care is personalised, but in a very confidential manner.
To complete the Data Security and Protection Toolkit that is needed to get access to digital tools for social care, there's an initial stage that has been created just for social care. So there are points that need to be completed, and at that point care homes can get access to NHSmail.
We appreciate that compliance with the Data Security and Protection Toolkit is a big challenge for the care providers.
When they brought out the new toolkit, I was quite nervous about how long it would take us to complete, whether or not we would have the tools to complete it. So it was really great to have the Healthy London Partnership support us through completing the toolkit.
What we've done is provide a support package that supports the individual care homes in getting through the onboarding process.
One of the things I've been involved with is developing guidance by care providers for care providers for the Data Security and Protection Toolkit. There is, for example, a how-to guide for the entry level, which gives people NHSmail. There's a new website called Digital Social Care, and it will have all that guidance on there. It will have all the links to secure email, NHSmail, the toolkit itself, but lots more.
We're also making sure that that ongoing IT support capability exists for the care home for when they get stuck. And having that person at the other end of the phone or the other end of an email, it's really important.
This is the start, and what it will do is open up then other opportunities to gain further and more detailed care information around the management of their residents, which can only enhance the care.
I'm really excited about what this can do for care homes, not just getting them onto NHSmail, but showing NHSmail as a starting point for them becoming far more digital and being able to deliver more effective care for their residents.
What NHSmail gives you is also Skype for NHS, so we could have video consultations with the patient's relatives, the carers in the home.
We've been supporting an innovative project in Sutton which is called the Digital Red Bag.
At the moment, what we have is a scheme called the Red Bag Scheme.
That's a paper-based flow. When a care home resident is taken into hospital, there's a bag which goes with their essential belongings and the sort of key paper records. So what we're doing now is digitising that.
So it really solves the problem of lost papers, knowing where that information is and accessing it quickly and easily.
If we can support homes through this Data Security and Protection Toolkit onto that and starting to show what they can do, then they move on to other digital tools which are more powerful and help them to do bigger and better things. And I think we're at a point where this is starting to happen and hopefully happening quite quickly.
Partnership working is really fundamental for digital working with the care homes.
So I think it's important London's health and social care work in systems together.
Where everyone is pitching in and the idea is let's do something, let's strive together and support the care providers to be at level playing field with the healthcare sectors.
It's clear we all have a lot to learn from each other.
So we need the NHS to keep remembering the care sector colleagues in their plans, but we also need the care sector to keep up. And now they've got this opportunity with services like NHSmail. There's onus on both sides to make that happen.
So I think it's going to be a big game changer in how we work within health and social care.
I think it is a big deal, and I think care homes themselves are going to find a really big impact on how they're able to look after patients and residents in the future.